vessels that deliver the blood to the individual tissues. Those are organs. They're made up of more than one cell type. They form a closed circuit. It's important to remember. They transport blood from the heart to the body, back to the heart, but the volume of blood should not change. There should be exchange of materials between the tissues and the blood, but there should be no leakage of blood between the tissues. The arteries carry blood away from the ventricles of the heart. You've got to get out of your mind, if you have it, that arteries carry oxygen-rich blood and veins carry oxygen-poor blood. That is only true in the systemic circuit. Arteries always carry blood away from the heart. Arterioles get blood from the arteries and carry it to the capillaries. The capillaries are the places where exchange occurs between the blood and the body cells. On the other side of a capillary bed, you would run into a venule, which would receive the blood and conduct it to veins, and veins receive the blood from the venules and carry it back to the atria of the heart. So again, arteries carry blood away from the heart, veins carry blood back to the heart. They have some very similar structures. They have a lumen. Veins will have valves that we do not see in arteries, and we'll talk about why that is later. But they all have the three tunics: the tunica externa, the tunica media, and the tunica interna. Angiogenesis is the formation of new blood vessels. Is controlled by a chemical called vascular endothelial growth factor. It's regulated in the body. We don't want excess, deficient, or inappropriate blood vessels, which do happen and can cause diseases. To promote angiogenesis, the body would secrete VEGF in response to a blocked artery. If it's not sufficient, you may be able to deliver VEGF may be able to be delivered in time-released capsules. To prevent angiogenesis, something we would like to do in tumors, we can use some anti-angiogenesis drugs to treat cancer and age-related macular degeneration. Cancer cells cannot survive without their own circulation, and cancer cells are solid tumors are very good at making blood vessels. So arteries are thick, strong-walled, thicker than the walls of veins. They have the three tunics: the tunica intima, the tunica media, and the tunica externa. They transport blood under high blood pressures, and they give rise to smaller arterioles. Those arterioles, their walls are thinner than they are in arteries, but they still have those same three tunics or layers. The walls of the middle and outer layers will become thinner as the arterioles become smaller. And both arteries and arterioles can undergo vasoconstriction and vasodilation, and that will help to control blood pressure systemically, as well as delivery of blood to particular parts of the body. Capillaries are the smallest diameter blood vessels. They connect the smallest arterioles to the smallest venules. They're really extensions of the inner lining of the arterioles. They only have the endothelium, which is simple squamous epithelium. They are semi-permeable. Capillary blood flow is going to be regulated by precapillary sphincters, which can open up to allow the capillary bed to be used with branches, or closed to make sure that the blood goes directly through what's called a meta-arteriole and directly into a venule. Substances are exchanged by diffusion at the capillary bed. Openings in the walls of the capillaries are thin slits found where the endothelial cells overlap. Their sizes vary among tissues, and that means the permeability will vary among tissues. The higher the metabolic rate in the tissue, the denser its capillary network will be. A rich capillary supply is found in muscle and nerve. They use large amounts of oxygen and nutrients. Cartilage has fewer capillaries. Capillary exchange of gases, nutrients, and metabolic byproducts occurs, tongue-tied, by diffusion, which is the most important method. Lipid-soluble substances can diffuse through the cell membranes. Water-soluble substances dissolve through the diffuse through the membrane channels and slits. We also have cases of filtration in which the hydrostatic pressure pushes the molecules through the membrane, and that pressure is derived from the contraction of the ventricle. And then similar to osmosis, diffusion, we have osmosis. There's an impermeant solute, such as plasma proteins inside the capillaries, that helps maintain the osmotic pressure. So osmotic pressure tends to draw water into the capillaries, opposed to filtration, which tends to push water out of the capillaries. At the end, arterial end of the capillary, H2O and other substances leave because of hydrostatic pressure, and at the venular end, they re-enter because of osmotic pressure. Veins, first venules, are microscopic vesicles that transport blood and capillaries into the veins. They have thinner walls and less smooth muscle than the arterioles. They tend to look larger than the artery at the same level, as you can see in this image, and you'll see on Thursday in the lab. The thinner walls, they still have all three tunics, but they are thinner. The tunica media is less developed. They carry blood under relatively low pressures, and because of that, they have to compensate to make sure that the blood only flows in one direction. And one way to do that is to have these flap-like valves shown here. I'm not going to walk you through this figure. It's good for you to read about and go through in your text, find out where the blood is at any given time. And I won't walk you through each of these in this table as we just went through them, but again, this is a good summary of what I've been talking about. So there are some blood vessel disorders you need to be aware of. Arteriosclerosis is a deposit of plaques on the inner lining of the walls of the arteries. Those plaques interfere with the flow of blood. We get something called turbulent flow, and that can lead to clotting and other issues. An aneurysm is a bulge in the wall of an artery. Usually forms when pressure dilates a weakened area in the vessel, and that can cause a wall to burst. Phlebitis is inflammation of a vein. It's a common disorder. Varicose veins are irregular dilations in superficial veins, seen most commonly in the legs. And I will cut it there.